Hello all, my name is Myles Davaris. I'm a PGY3 and a PhD candidate at the University of Melbourne, Department of Surgery, St. Vincent's Hospital. This study is part of my thesis and has been published in the Bone and Joint Open Journal. I am the current recipient of the Melville Hughes Scholarship 2020. With the rise of digital technology, patients have often turned to the internet to better understand their health concerns. Patients, healthcare professionals, and other third parties have leveraged its use, seeing it as reliable and accessible. Adults are increasingly using the internet, and a large number are using it to self-diagnose without clinician follow-up. Online health information is largely unregulated and can influence patient expectations and decision-making. We know that 60% of patients have low health literacy in Australia. A body of work indicates that poor health literacy leads to poorer outcomes. Hence, health literacy and e-health literacy skills are essential to filter through accurate and relevant information, especially for those non-English speaking and the older demographic. While this can be a difficult skill set to cultivate, clinicians may serve an important role in directing patients to the appropriate online resources. But which ones are they? We know from previous research that online information differs in quality by search term, language, and on which page of search results it appears. No analysis has been done to quantify the quality of information on the internet regarding total joint replacement. Now, there are several online instruments to measure information quality. In our study, we used the Health on the Net, or ON, tool, which is a free, validated international standard for assessment of information quality online. It is a not-for-profit accreditation body supported by the World Health Organization. We used OnCode for its practicality, accessibility, and time efficiency to assess over 10,000 websites. Easy to download and install, OnCode works automatically when you visit a website, lighting up if the website is on Accredited. The algorithm is designed to read the website code and compare against its 8 criteria. A website owner may apply for ON accreditation, after which the ON team works to refine the website so that it adheres to all the criteria, thus receiving the ON endorsement. We developed an algorithm of our own that uses OnCode and conducts searches on the Google search engines. By inputting search term, language, and number of items to be returned, this algorithm automatically generated an Excel sheet showing which websites were ON accredited. Search terms were also organized into 7 categories to facilitate analysis. We tried to capture the formal medical terms as well as the lay terms to see if there are any differences. These 18 terms were determined by an expert surgeon scanning online patient forums and interviewing patients firsthand who presented for joint replacement surgery about whether they used the internet and what search terms they used. We stopped collecting this data when no new search terms were coming up, which was about 15 patients in total. As there is evidence to show that patients rarely go past the first page, when conducting searches, like other similar studies in this field, we assessed the first 150 websites to see what information was being missed. Using Starter, we conducted statistical analysis by search term, language, and tertile. For the English websites, we manually assessed and organized websites into one of 7 sponsor groups, namely who made the website. What we found was that the search term total joint replacement returned 146 million websites, the highest of all search terms, followed by bone-on-bone arthritis returning 118 million. Unicompartmental knee replacement had only 240,000. Most formal terms like total hip arthroplasty versus total hip replacement returned far fewer websites, 5 million versus 70 million in this case, but a similar percentage of unaccredited websites, and sometimes more. Overall, there was a median of 12% of unaccredited websites by search term. Between languages, we found an equivalent proportion of unaccredited websites, similar to other studies out there. And predictably, the first tertile, the first 50 websites, housed the largest percentage of unaccredited websites compared to the second and third tertiles. Again, a similar finding to other studies. For sponsorship analysis, government or educational institutes supported 39% of websites, followed by orthopedic specialists and professional organizations at 26%. And then interestingly, commercial sponsors at 18%, which is higher than in other studies. In comparison to other studies of this sort, these findings are consistent. For topics like thoracic surgery, gynecological, urological, and surgical oncology, on-accredited websites were scarce, numbering between 7 to 25% per category. The lack of linguistic differences was also comparable to these studies. This reflects a shortage of reliable online information. Now, these websites suggest that patients encounter poor quality online health information, and marketing forces impact on where websites feature. Some websites pay a premium for pay-per-click advertising and to appear more prominently when a search is done. A search of total joint replacement may yield different results on Google, Bing, or DuckDuckGo, for example, and future studies could investigate this. Limitations of this study include the use of OnCode itself. Websites may exist with objectively high-quality information that do not fulfill OnCode criteria. For example, the Victorian State Government website is unaccredited, while the other states are not, and nor is Scotland's NHS website, nor several leading American university hospitals. And these websites appeared numerous times in our search. Yet these websites may in fact be accredited by other tools. In a wider context, patients must heed caution when consuming health information on a largely unregulated platform. However, an opportunity presents itself where clinicians can encourage patients to download OnCode to find more reliable information. And clinicians can also take the initiative to identify and give patients a list of websites approved by them and empower patients to improve their ability to find better online information. In the longer term, both parties can also take this opportunity to work together and develop a platform for disseminating reliable information. Thank you.